Hello students, let us discuss the learning media assessment for the visually impaired children. When you think of persons with visual impairment, the fact you should know is that all visually impaired persons are not equal. Approximately 90% of the individuals with visual impairments have functional vision or low vision and just 10% are functionally blind. However, students with low vision are often an overlooked majority among visually impaired population. Difficulties of students with low vision are often not as apparent as in the case of students who are blind. Students with low vision require direct instruction in literacy. Educational interventions are crucial to help students in any school setting. In the education of visually impaired children, there are two main categories. The first category includes those who use techniques typical to blind persons. They use non-visual methods like touch methods. The other category includes those who use varying combination of low vision techniques and also blind techniques. The study techniques of blind children are rather similar. They all use braille for reading and writing and tactile materials for learning. But low vision children and their study techniques are highly individual due to structure of their impairment and the degree of disability. A number of techniques need to be used in all areas of daily functions. Hence, selecting of effective study techniques require a thorough assessment and an understanding of the child's visual capabilities. Before going for an educational assessment, screening of visual impairment is essential. In screening of visual impairment, there are 5 different groups that are classified for educational purposes. In the first group, we include those persons who have no light perception. No light perception means complete absence of vision. The next group includes those who have light perception but no projection of light. They perceive light but they cannot locate where the light comes from, whether it is a natural light or an artificial light in the room. Children in the groups 1 and 2 use techniques of blind persons in all of these functions, but children in group 2 may use vision in orientation in the known environment. They can discriminate day and night, locating sunlight, and they may identify direction. They could identify rooms when the doors are open where light comes out. The third group includes those who perceive light and also they can locate the direction of the light. They can locate from where the light comes from. Children in this group use techniques of blind people in most areas of learning. Although most of them are braille readers, they can use vision for orientation mobility. Many of them can use colors quite well as a source of additional information. This could be paid more attention since color coding would be as simple and effective for helping these children to use their vision. The next group includes those individuals having visual acuity of less than 3/60. The fraction less than 3/60 indicates that when a person with normal vision can see an object at 60 meters, a person with low vision can see the same object at less than 3 meters. The children in group 4 are classified as children with moderate to severe low vision and are functionally very different. They may have good use of visual teaching materials if these are relatively simple and drawn at high contrast. Therefore, their assessment requires more tests. The children in group 5 have visual acuity ranging from 3/60 to 6/24. The children in group 5 have moderate to significant residual vision. In this group also, each child with a learning problem needs a thorough assessment. Low vision is a complex entity. It includes a number of visual problems. Low vision can mean tunnel vision. The person having such type of vision feels like seeing through a tube. In some children, central vision is lost, but only visual intact in the peripheral area. In some, it is a scattered vision. They see like looking through a broken mirror. And in some, it is a depressed vision and things appear blurry to them. In order to determine the learning medium, we have to administer the visual assessment. The first is the assessment of the distance visual acuity. Distance visual acuity measurement is the first test performed on the child. If administered correctly, it sets the tone of the rest of the examination. Information on distance visual acuity helps teachers determine how the student can perform activities such as blackboard, diagram chart and television viewing or physical education. The children can be tested with the optotypes including E-chart, Snellen chart or LH symbol test. The major concern for measuring near vision is to involve the children in near tasks, especially in reading. There are numerous near vision charts available with single letters, numbers, multiple letters and numbers, words, phrases and sentences with varying levels of difficulty. A suggested starting point is a chart with a single letters or words or numbers. If each chart is used to distance acuity, they can also be used to test near vision. This type of chart will be easier for the children to see and elicit the most positive response. This test gives a preliminary information on the size of the text the child might be able to see. Reading acuity involves 4 components: reading threshold, optimal size, reading speed and reading comprehension. Reading threshold is the measurement of the smallest text size that the child can read at a comfortable distance. It also indicates what is the smallest size the child can read at a closer distance. For example, a low vision child reads 12-point text at 25 centimeter distance, which the child finds comfortable. Then the child can read 8-point text at 10 centimeter, which is the closest distance to read the smallest pen size. It is the measurement of how much larger the text needs to be to allow fluent reading for a longer period of time, which is based on the measurement of the optimal size of the text. The teacher can calculate the size of the text the child uses in his or her classroom. Text sizes vary from 8 point to 20 points in the classroom. Magnifiers can be provided if the child can be benefited out of it. It is the measurement of how many words the child can read per minute of an age appropriate text and how many reading errors he makes while reading. The kind of errors generally children commit are regression, that is going back and forth, addition error, adding words, substitution error, substituting new word for the existing word, and omission, that is omitting a word or a sentence. The reading speed is crucial to develop reading skills. Reading speed with maximum of 25 words per minute is needed for comprehension. Testing the ability of the child's comprehension of the text during the first reading. The teacher needs to prepare a few questions about the content of the passage beforehand and the child's answer may be recorded. If the child uses all the energy in reading and does not remember the content, he or she can be allowed for a second reading. Finally, the teacher can ask the child about possible distortions of the straight lines and about blurred letters or disappearing of some letters to get an idea of the quality of the central field for reading. If there is a loss in the central field of vision, reading speed may remain low even after training. Let us see how eye conditions or eye diseases have implications on education. The teacher of visually impaired children usually serves children with a variety of eye conditions. A general knowledge of educational implications of eye conditions can be helpful to the teacher of the visually impaired children. So, a teacher needs to look into the report of the ophthalmologist, which may provide information about the causes of impairment, field of vision, prescriptive lenses, and prognosis. This information will offer the teacher some rough guidelines to the teaching of children with specific kinds of eye problems. The type of eye condition is one among the important factors that should be carefully considered in planning educational programs for the low vision children. Visual field testing with low vision persons is more of a functional test than disease detection oriented test. This test will give an understanding of the field of view of the person. The information is used to determine the need to refer to for orientation and mobility services. Contrast sensitivity measurement is an important part of the assessment of the children with low vision. This test may indicate the need for increased illumination and contrast for reading. Proper contrast between the visual task and the background improves visual performance. If the background is too much brighter or darker than the brightness of the visual task, we have to make adaptation from one brightness level to the other with a resulting loss of visual performance. Brightness or a sufficient quantity of light is essential to the visual learner to accomplish visual task. Most visually impaired children benefit from high levels of illumination. Averaged brighter lighting would generally be needed for persons having retinitis pigmentosa, glaucoma, corneal scarring, coloboma iris, diabetic retinopathy, retrolental fibroplasia, retinal detachment and uveitis. Average to dim lighting is preferred in albinism, aniridia, surgical aphakia, peripheral cataracts, corneal grafts and dislocation of lens. Dim lighting is needed with achromatopsia. Glare is any brightness condition that causes discomfort, annoyance, loss of visual performance or eye fatigue. Protection from glare can improve visual functions. Glare in the reading task can be prevented by careful selection of textbooks which use non-glossy inks and paper. Proper seating of the child in the classroom can help reduce glare. The children should sit and stand in position which direct their vision away from the windows. Pictures, charts and other visual materials should never be placed between or adjacent to the windows. Natural light coming from top and bottom of the windows is usually better because of less glare. Most individuals with color vision defects either have less sensitivity in the cones in general or lack pigment in certain cones. The easiest test is to have match colors and sort colors. One of the first questions asked about child's learning is what his or her primary reading medium. The teachers and parents may be uncertain as to whether a child should learn braille, rely on large print or use regular print for reading. The purpose of learning media assessment is to determine the most effective medium for accessing instruction and teaching methods. The learning media assessment covers both general learning media and literacy media. General learning media are instructional materials and instructional methods. Literacy media refers to reading and writing in print and braille. The totally vision impaired children use braille as their learning medium. Let us discuss in detail the selection of appropriate learning medium for children with low vision. The ability to communicate effectively through speaking, listening, reading, and writing to the extent of one's abilities is of fundamental importance in achieving assimilation into society. The most vital component of the total communication process is reading. Reading and writing is of equal importance and value for individuals with visual impairment. An efficient reading medium facilitates literacy and integration into school and work environments. For sighted, print medium is the universal method of expressing language. However, for children with low vision, the decision regarding appropriate learning medium is not straightforward or predetermined in any way. Literacy is measured by the ability to demonstrate effective reading and writing medium. Hence, much attention to be devoted to making decisions about learning medium. Reading is not performed through continuous eye movement, but it is performed through sudden changes of fixation, fixating the eye at a given point in a space encompassing the surrounding letters. The speed limit of the eye to shift from one fixation to another is determined by the time that brain takes to process the information input. Faster reading is not achieved by quicker eye movement, but an expansion of visual field. Visual process plays an important part in print reading. Reading speed is a factor specially affected by visual deficits. The reading speed is influenced by the factors like visual functioning, kind of pathology, and the kind of optical help needed. For many young people with vision impairment, the inability to read is the most serious consequence of their eye disease because of the input it may have on learning process. Low vision persons have some differential characters that sometimes teachers do not evaluate. Textual information is processed differently by central vision and peripheral sides of the retina. There has been ample discussion among the professionals in the field as to the superiority of one medium over another medium for students with low vision. However, such a discussion does not reflect a full appreciation for the complexities and differential characteristics of children with low vision. There can be no predetermined reading medium for all students within an arbitrary category, but the principles of educating each child to his or her individual capabilities and needs are upheld. When children who show a preference for gathering information visually can develop efficient reading skills through the visual channel. So, the primary consideration should be given to instruction in reading in print. For students who do not have sufficient visual functioning to develop efficient reading in print, the consideration can be given to instruction in reading braille. Some children may need both print and braille for their education and life situations. The value of one medium over other is not a matter. The important factor is the degree of care that is taken in matching the appropriate reading medium with the child's individual sensory and reading capabilities and needs. The task of the teachers is to provide instruction in learning medium or media which allow the child to become a literate adult. The teacher should not restrict opportunities for achieving literacy by failing to match child's existing abilities with the appropriate learning medium. The determination of the appropriate learning medium is but one of critical decisions. The appropriate learning medium is based on a set of fundamental principles that reflect the individuality and learning characteristics of each low vision child. Some of the principles you may bear in mind are: each low vision child must have a learning medium based on the individual needs and abilities. The teacher should be knowledgeable of the child's unique abilities and needs. Students with low vision possess a wide range of learning characteristics that are unique in themselves. For example, reading with central vision or reading with peripheral vision. So, no global statement can be established for the total population. It should be based on individual learning characters. The student who show a preference for gathering information visually can develop reading skills in print. The students who do not have sufficient visual functioning can be given instruction in reading braille. Instruction in both print and braille may be appropriate for some students, for they may need very large print for some educational purposes, and for a majority of his educational aspects he may be using braille. Some children may use print in daytime for short duration and braille for night time. Some students may need print but cannot write print. They can be allowed to use both methods. The determination should be based on the student's unique sensory capabilities, ability to receive information through sensory channels, stability and prognosis of the eye condition. The decision should not be on arbitrary criteria such as visual acuity or legal blindness. Each student with low vision should be assured that decisions regarding learning medium are based on sensory and overall visual functioning. The teacher who determines the medium should have professional training and professional judgment. The professional involved in the education of the children with visual impairment should realize that children should have communication ability to assure independence and privacy. The teachers and the educational team should have professional judgment in matching the appropriate learning medium with the child's individual sensory and learning capabilities. I would like to say in nutshell that students with low vision possess a wide range of learning characteristics that are unique in themselves. The decision regarding the appropriate learning medium is not straightforward or predetermined. The teachers and the educational team should have professional judgment and insight to decide which medium is suitable based on the visual capabilities and sensory abilities. Thank you.